Hi, I'm Dave Graveline, host of Into Tomorrow. Do you wear contact lenses or glasses? And aside from the expense and hassles, do you wish you could see a movie or drive or go swimming or maybe play sports without them? Well, I wore lenses for many years, and about 8 years ago, when LASIK was just getting popular, I had both of my eyes treated. Back then it cost about $4,000 per eye, and while it was pretty basic, it was very successful. And I've been able to see distance very well since then. The problem was, I still needed help for reading and computer work. And since I'm on the computer constantly, I needed some correction for the close-up work. Well, it took a good month or more to get used to wearing one contact lens in my left eye, while my brain got used to seeing distance with my right eye. Aside from the expense and pain of having to deal with sticking things in your eyes, there's also risk in getting various eye infections and other problems when using contact lenses. Let's face it, while they work very well, it's just not natural to stick things in your eyes, if you can avoid it. Well, recently I learned that with new LASIK technology, they could do an enhancement, and then I wouldn't have to wear even that one contact lens anymore. Sign me up. When we see normally, light enters the eye through the cornea where it is bent or refracted. It then passes through the pupil and into the lens where it is bent or refracted again. Then the light comes to a point focusing on the retina. With LASIK, precise and controlled removal of corneal tissue by a special laser actually reshapes the cornea, changing its focusing power to correct or enhance our vision as needed. Before you have any LASIK procedure, there are several critical evaluation steps. So let's visit the Laser Center of Coral Gables, Florida, where optometric technician Joanne Leopold performs a variety of painless tests and scans to gauge the health of my eyes and document my personal eye characteristics. Yep, these days technology lets them do sort of a fingerprint of your eye, thereby being a lot more precise than ever before, since everyone's eyes are unique. During these exams, some people may find out that they are not good candidates for LASIK, though that is rare. Here, with even more extensive testing, Center Director Dr. Adam Stelzer has determined that, like most adults, I am a good candidate. The team comes up with a custom roadmap for my particular enhancement procedure. Medical Director Dr. Alberto Aran is the surgeon that will be performing the procedure on me. And don't worry, even if you're a bit squeamish, there's nothing here that you shouldn't see. Doctor, what actually is LASIK? What does it stand for?
Laser-assisted in situ keratomileusis. And keratomileusis is when you change the shape of the cornea with a procedure. And in this case, it's a laser.
This is my Valium. Not because I'm anxious about the procedure, because I've done it before and they were great, but because why not? Thank you, Joanne. So might you need LASIK again, even in the future, as your eyes change?
Some people need what's called an enhancement, and they come back a year later or 5 years later or 10 years later and we do a touch-up. But when we do that, first, it's a minority of the people. And second of all, what we're setting the patient for is distance vision or distance and near. And where you set it is where you like to keep it.
How has the technology improved, for example, in the last 8 years since my first LASIK?
I would say we change software once or twice a year. So it continuously, and it's an evolving process, continues to change.
And how many different LASIK procedures are there anyway? I know you have standard and custom and bladeless, or I think what you call epi-LASIK.
We can do an excimer laser treatment on the surface, and that is called PRK, it's called LASIK, it's called epi-LASIK. There's several different ways of doing it, but those are all surface treatments. The LASIK treatment is under a flap, and the LASIK treatment is the one that gives you the quickest recovery with the least medication and the most wow factor.
Okay, can you explain in detail what you're going to be doing to me today?
The first thing we're going to do is to find the edge of the old flap. Then I'm going to go into the flap and create an opening. Then when we go in the room, I'm going to dissect through the little opening I made here Look down. Straight at the light. It's a blur. Stay right where you are.
Okay.
Perfect. Doing great. Perfect. Perfect. Doing perfect. Stay right where you are. Almost finished. Doing great.
5 seconds. 3, 2, 1.
Okay, done. Put the flap back, and that's it.
And that's where I get squeegeed again.
Yes, the
Little
squeegee at the end of the case, correct. You feel back to normal the next day, and then you use medicines for 5 days, and that's it.
How are you so excited about doing what you do?
It just changes people's lives. I've had people jumping up and down the hall. You know, people get the LASIK procedure, they come in back 3 months later, 6 months later, you don't recognize them. They did their hair, they lost 50 pounds. It's really a life-changing procedure for some people because of body image. And the fact that they wore the thick glasses or stuff made them think they were nerds or, you know, something else. And it really does, you know, go all the way to the soul.
Well then, now I'm looking forward to those 50 pounds falling off too. Okay, I know that's up to me, but he does bring up a great point. LASIK is life-changing, and you can donate your glasses to others who could use them. You no longer have to be dependent on glasses or contacts. And while my eye is still healing a bit, and I need to be careful not to rub it or get an elbow in the eye, it is much better. At the moment, I'm having to use some reading glasses for all my computer work, but I look forward to my newly enhanced eye settling down and not needing those glasses any longer. Proper follow-up should include exams 1 day, 1 week, 1 month, 6 months, and 1 year after your procedure. And of course, regular checkups. I want to encourage you to talk to your eye care professional about these kinds of technologies to correct or enhance your vision. And check out all the links on our site at graveline.com or intotomorrow.com for much more information about LASIK, a procedure that takes only a few minutes to perform, but can have a tremendous impact on your life. Let us know if we helped you. Thanks for joining us. Stay tuned into tomorrow.